Hi everyone, Dr. Rich Castellano, the Smile Doctor here at Image Lift. We're here today with Eunice. Thank you, Eunice, for letting us share your treatment today. We're going to be doing some Sculptra in the mid-lift. Are you excited to have your treatment done?
Excited and nervous.
Excited and nervous, but you had the relaxing medicine.
I do.
So you feel that. It feels like a few cocktails coming on, a few glasses of wine. And so I'm curious, what inspired you to have the cosmetic treatment done, Eunice?
Well, I just looked in the mirror one day and realized all of a sudden it was different. And I just, while I'm still young enough and the skin's still in good enough shape, to just do a little nip and tuck.
There you go. Now, can we share with them, the viewers, how young you are?
I am 69. I'll be 70 this year.
That is amazing. Congratulations. You don't look your age. He doesn't act your age. People are living so much longer. They're looking better. Now, we talked about doing the Sculptra. We're going to focus under the eyes and then a little bit in the brow as well. So I'm going to do a little cleanse on the skin. And we've got her pictures right over here, her before pictures. So you can see the little hollows. We're going to follow the hollow. We're going to do the Sculptra, and then we're going to do lifting and tightening afterwards with our mid-lift procedure. So cleanse with the Hibit Cleanse. And so make sure you're following and you get our alerts because we will be doing her procedure as well. Everything's looking good. So I use the lidocaine for numbing. And I like to dry the alcohol because the alcohol can burn while you're injecting. So that way it's dry and it feels better. You feel a little bit of a pinch. So you feel buzz. Pinch on 3, 1, 2, 3, pinch. Sculptra is poly-L-lactic acid. You feel a little pinch, small, medium, big there? Tell me what you feel.
Just
A little bit. 1, 2, 3, pinch. Same thing on the other side. So poly-L-lactic acid, it breaks down into lactic acid, which leaves behind your body's own collagen. 1, 2, 3, pinch. A little bit of numbing. That's where I'm going to insert the cannula. And I use that soft tip cannula, pinch. Everything's looking good. Then once I've done the numbing, you feel a little bit of a pinch there or not too bad? So that's the insertion point where I'm going to introduce the cannula. Same on both sides. Sculptra is a gradual filler. You see some result immediately, then it goes away 100%. Then over about 3 to 6 weeks, you'll see some improvement. But even up to 2 months, 4 months, and 6 months, you'll see continued improvement. Hold a little pressure here just to reduce potential for bruising.
Eating a lot of pineapple.
That's good. Eat the pineapple, bromelain, arnica montana, all of it's good.
Yeah, I did arnica too.
I like to mix the Sculptra right before I inject it, and you can see, if you look closely, it can settle. I don't know how well you see that there. So then I put an air bubble. And mix. This is the last one, so I'll do this one last. But you can see once I inject it, it looks nice and more uniform, a little grayish all the way throughout. So this one is the last one I'm going to inject.
That was the last one.
Boy, these cannulas. I need to talk to the cannula people because they keep, every time, they're great cannulas, but then you can't get them off the syringe when you twist them. Okay, so, mix this one more time here. I like to start in the cheek. The cheek lower below the eye feels a little numb and goofy. So I find that little insertion point where I place the cannula, twist, twist, twist. You'll feel a little pressure, a little pinch. Shiver technique to put a fine amount of filler over a large area. How are you feeling, Eunice?
Oh, I'm fine.
Everything's looking good. Perfect. So I go from side to side to make sure we're maintaining symmetry and balance. I like to cleanse the cannula with an alcohol swab in between. I use the soft fill cannulas. This is a 25 gauge 2-inch cannula. I still like them. They have a little red dot that shows the area where the insertion, the opening of the cannula is. So now I'm just angling towards the apex of the zygoma. Twist, twist, twist to make sure we are in the correct tissue plane. Subcutaneous. Goes very easily. You feel small, medium, big pinch there, not too bad. I'm not in a hurry if you need a break. And it'll feel numb and goofy under the eye. Shiver technique and twist technique. There's also, go ahead, Eunice.
Is Sculptra like a hyaluronic acid?
Hyaluronic acid is a gel that plumps and it also absorbs a little bit of water. That's a fine line filler. Sculptra is different because Sculptra is a collagen stimulator. And it's not a gel, it's a liquid. And Sculptra definitely lasts longer, 2 to 4 years. And I think does a better job under the eye than the fine line fillers. Let me turn your head this way a little bit. Twist, twist, twist. Now she'll feel much less. So each syringe I'm injecting about 0.8 cc's. And I'm right at the level of the orbital rim, a little above in some cases. Everything's looking good. Thank you for watching. Thank you for sharing. I promise you, you have a family member or friend who's interested in having a cosmetic treatment. So share this with them so they know the right way to do things. You want to keep them out of trouble and keep them safe. They're going to be upset with you if you told them you were watching a live video treatment and then you didn't share. We're on a mission to stop back plastic surgery. We're here to help you raise your standards. Turn your head this way. I like to talk about my ABCs of plastic surgery. When you know the ABCs, you will make your best decisions because you understand the big picture. Little pinch there, not too bad. A stands for area. There's 4 main areas we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free facelift when we smile. And Eunice knows the power of smile. She's a very good smiler. So those are the 4 areas. B stands for boundaries. What a little pinch there. What are the rules for good plastic surgery? Safety is always first. You must look natural. Let's prevent future aging and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. And if we need to come back another day and do more, it's better than going too far. How are we feeling, Eunice?
Good.
You're doing great. I love the results I'm seeing. I love to build around the brow. This is a very subtle volume brow lift. You don't want to overdo the brow lift, so this won't do that. This is subcutaneous and suborbicularis. Pressure, pinch, twist, twist, twist. And I'm just going to put about 0.3 cc's, a little bit of numbness there. Very gentle pressure. 0.3 cc's, and then as soon as I do that, then I'm going to massage. So spread that out. Sometimes I'll do 1, 2, or 3 sections to build the brows. You don't want to use too much there at one time. But when you gradually layer it in, you get a really nice result. And just look at your photos from when you're in high school or in your 20s, and you'll see how that volume changes. Pressure, pinch, pressure, pinch. Everything's looking good. Perfect. With Sculptra, you can, a little pinching there, you can overcorrect just a little bit because that swelling that you see is going to go away. Perfect. A little more to go, then we're done. And please do like and share because we're going to be broadcasting again here soon to show her lifting procedure. And I'm going to balance a little bit below the cheek as well. So just to blend. Pressure pinch. Circular fashion fanning technique. To blend the volume, submalar area, all of these areas are really important to make sure you've got nice, good fullness. We lose bone as we get older, so this makes up for that bone loss. Perfect. And that's the apex, the malar apex. A little bit more to go, then we're done. Thank you to my amazing team for setting everything up perfectly for me. Makes it so easy.
You're welcome.
We have such an awesome team here. Give us a call, 813-463-9245. Our seminar is later this week, so we'd love to see you there. Little blend, little balance, submalar. Very good. When I first did injections with Sculptra, I did that with needles and people bruised a lot. Now with the cannula, there is far less bruising. It's much safer this way. Last little bit, then we're done. Laterally, it's important to have some good volume there so that it balances what you've built up in the cheek. Everything's looking good. Okay, we're completely done. Hopefully that wasn't too bad.
Nope, not bad at all.
Can you feel that numbness under the eyes?
Yeah, a little bit.
Open your eyes for me. So it's a little bit swollen, but can you see how that builds up there? All right.
Yeah.
How does it look so far?
Good.
Make a big smile for me, big smile. And relax as best you can. So that's one vial of Sculptra. Now let's take a look. You see under the eyes here where she's a little hollow. And now when you look back, you can see how it builds that area up. Now it'll feel goofy with that numbness, but that's exactly what we want to see. And we did a little bit in the brow as well. Thank you for watching. Thank you for sharing. We'll see you in the next video. We'll be doing her lifting procedure. We'll see you then. You did great. It looks really, really